Technology Committee. Now, Business, Labor, and Technology actually does a lot of the legislation around health insurance and companies. And because in essence what we're doing is designing a self-insurance plan, it actually is appropriate that it go to Business, Labor, and Technology. And the section of the law that it's changed is in section 10, which is where the insurance code is written in the law. Looking to see, oh yeah, they usually have a copy of the bills of the law back there. There's about 25 or 30 books that are Colorado statute. And so the part of the statute that would be changed is section 10. I have just up until now been working primarily with Democratic colleagues because I wanted, since we have a majority in the Senate, I wanted to first make sure I could get it out of the committee and out of the Senate. I do think we can get it out of Business, Labor, and Technology Committee. I don't have the numbers down yet to know for sure we could get it out of the Senate, and I will be looking at those and talking to my colleagues in the near future, saying, okay, we're going to get it out of committee, we're going to vote when it comes to the Senate. But I think it's really important that this be a bipartisan bill if it can at all be. And I've been working really hard to develop relationships with a number of Republicans around the bill because it is about being fiscally conservative, and it is about being efficient, and it is about decreasing the role of government in healthcare, which are values that I think a lot of my colleagues embrace. And it is about caring for people in rural areas and being sure we have the resources where we need them and not just where the most money can be made. And so, so that's the political strategy. In terms of what's in the bill and what the healthcare system would look like, I don't know how much people want to hear, but I want to stop right now for any questions you have right now. Ron.
You can file a cooperative immediately at the Secretary of State's office. What you should be working on is the bylaws. They should be written, and most of the bill can be incorporated into the bylaws so you can present 3 or 4 pages that people agree with and write it into a state bill in that form. Now, 2 things. People actually catch diseases by going to the hospital, and they catch diseases by over-medication. You can fund it through employee contributions and employer contributions. And what I object to in this bill is you're forcing people to join, and it should be a voluntary bill.
And that's actually interesting that you bring that up, Ron, because one of the things I've referenced is that there is money in national reform to pay for innovations in healthcare financing and delivery. Because our national legislators are concerned that if healthcare costs continue on their current trajectory, they will be unsustainable. And I did get a chance to look in on the internet for what's been developed around the cooperative funding. And there are 2 key things in there that will need to be kept in mind as this plan is developed and moves forward. One is that it's supposed to be completely independent of state government. Now, the other good thing about it is it can't be formed by a company that existed as of right now. So it's not like somebody like, I don't know, I won't even name a name. Let's say there was Larimer County HMO. They couldn't come in and suddenly decide to become a cooperative because they already exist as an insurer. It has to be a brand new company for the federal grant. But the second important thing is that it has to be voluntary. And so as we go on I've been doing research, and he as well, and anyone else who's interested, will have to look at that model. But that will be one thing that the consultant would predict. What would it cost if everybody automatically joined, in which case it might not be eligible for the federal cooperative grant? Or what would it cost, or what would our anticipated enrollment be if we made it voluntary? And those things can be worked out in the future as well.
I just want to say one more thing about the cooperative model. We put in the bill that they can essentially do clean campaign laws so that the members that are elected to the cooperative would not be elected by big money like it is in our political elections. That the cooperative could actually set up rules saying that the only way you can advertise yourself is in a booklet where you each have so much space. We're at a debate where you each have so much space. So it could be a great addition.
I come from the Yellow Cab Cooperative.
How soon can Colorado apply for that federal grant, and who will apply for it?
So part of why I'm doing through this, well, there are a couple of reasons I'm doing this through the legislature. One is because a lot of the information on costs and pricing and need can be proprietary, meaning that companies don't necessarily want to share it. And so this is one way to put a little bit of authority and help get that information that you need to really design a plan. The second is that in order to do it most successfully, you would apply for waivers, which the legislature would need to do. Waivers around how you spend your Medicaid dollars. And then also, at the very least, a waiver to become a Medicare HMO to operate in that manner. And so it depends, to answer your question though specifically, it depends on if we try to go for cooperative funds and we decide this will be completely citizen run, then I think it would be a citizens group that would apply for the grants. But if we go for another type of funding, it could be coming from the legislature. The other things that there's funds for innovation are around the concept of patient-centered medical homes and integrated healthcare systems and accountable care organizations, which are all things around payment reform that are incorporated in the details of the bill. Yes, Parsha.
How's the fiscal note on the bill, or are you looking at gifts and grants?
So, as all of you know, we have a severe budget deficit in our state. And so we are committing to do gifts, grants, and donations. We have a number of different organizations who are interested in approaching to do the gifts, grants, and donations. My estimate off the top of my head with absolutely no knowledge, but that's what legislators do, is it would be between $500,000 and $1 million to pay basically the consultant to do the work and get the information that's needed. And that sounds like a lot of money to everyday people, but if you look at it as a bunch of $50,000 grants, it's not unobtainable.
Could you list other states that are working on roughly comparable plans, or in addition to California and Vermont?
I actually am not familiar with all that's going on across the nation right now. I think there are a number of states that tend to be a little bit more conservative leaning that are hoping that the Supreme Court will declare the mandate unconstitutional and are probably dragging their feet. And so most of the work that's being done in states is being done around the exchanges because there's so much uncertainty about what will be allowed from a federal level as this moves forward. There are some people here who work with groups around the state, and I don't know if around the country. Oh, Bill.
There are about 15 other states that are working on single payer.
The last count was 18.
So there are 18 states, it sounds like, that have little movements towards single payer health care. I intentionally chose not to do single payer because that ends up bringing up values of big government and government control and loss of freedom for some people. And really, our goal is to have a healthcare system where there's a lot of freedom and choice, and where we expand choice, and where we have more transparency as stockholders or owners in our own health insurance plan. I remember I made an enemy one time at a conference. A gentleman had gotten up to talk about all these great things that the pharmaceutical companies were doing in Africa around smoking cessation. And I remember saying out loud, and that was my mistake, and I do that a lot, I remember saying out loud, first of all the things they have to worry about in Africa, is smoking really at the top of the list? But then I said, secondly, those are our healthcare dollars. Pharmaceutical dollars are dollars we've paid toward our healthcare. And not that we don't want to help other countries, but there are many ways in which the United States can still be seen as a third world country, and in not providing for basic health care for everyone in our country, I think that's one of the ways in which it can be seen that way. So I don't even remember what the question was. I got so off track. Anyway, what was the question? Okay, another question? Stunned into silence. Well, then you're going to be bored with details about how I would envision health care in Colorado. I shouldn't say America. One of the things I love about Colorado is that we have in urban area, but we have a lot of rural areas as well. And so I really think that if we can devise something that works for everybody in Colorado, it would help a number of different states that are not just urban-based. One of the biggest cost drivers in medicine today, we used to hear it was the last week of life, and that's not it anymore, actually. It's chronic disease. So by chronic disease, I mean things like diabetes, high blood pressure, asthma, heart failure, lung disease. And so, so when you hear people talking so much in the national media about obesity, that's part of why they're talking about it so much, because obesity is a big contributor to diabetes. Diabetes is a big contributor to heart disease, and so on. And so if we're really looking at the health of the people in Colorado, we really need to be looking at what kinds of things are we doing that are making us unhealthy. So I think obesity is an area of focus. But right now, as I said in the press conference, it's true. If you're otherwise healthy, if you're not sick and coughing or febrile or feeling terrible, most people don't go to see a healthcare provider at all and don't think of health as something they need to worry about. And so what we want to go back to is a little bit more of a model of population health, where if everybody belongs to the system, then hopefully you belong to some type of practice, whether it's run by a doctor or a nurse practitioner, whoever you choose to be your primary care provider. And that person works with you to figure out how they can help you stay as healthy as you want to be. And the more I talk about this with people, it occurs to me, thinking outside my normal vision, there might be providers who choose to do that in a model that's very much based on integrative health and more natural health things, whatever their model is, just so you see what it is they provide and you choose whether you want to be part of their practice or not. And for the system, so they provide us data on what the health of their people is like. Because I think there are a lot of things in medicine that we do that we know work great, but there are a lot of things we do that work, just a little bit better than something else. And so this would allow different areas of the state, different providers, to really innovate around how they keep a population healthy. And as many of you know, the best way to help somebody help themselves is for them to really be part of it and believe in it and be invested. And so that's why this concept of having patient-centered medical homes is so important. Part of the idea behind that is that the doctor is motivated to keep you from needing medical care, because they get paid the same no matter what, except maybe you'll get bonuses if they do a really good job, but their salary doesn't depend on you coming in all the time, it depends on you being healthy. And so we want to put the financial incentives on keeping people healthy and helping them to become healthy in the easiest way possible for them, and letting the innovation happen at that level, the provider, patient, or consumer level, because we're not all patients, a lot of us are healthy, thankfully, at the provider-consumer level, and how do you help these people keep their health as good as they can. And I'm going to wait 1 second to see if I have another question, and I'll come back to you. Michelle.